Stop me if you've heard this one before. A big pharma company knew that it had a defective, dangerous vaccine and didn't do anything to stop it from hitting the market. Newly released classified documents in the landmark lawsuit against Merck reveal that Merck and the FDA knew the vaccine maker didn't conduct proper testing for DNA contamination, but instead they covered it up. Sound familiar? Dr. Joseph Verone is a former chief of critical care and COVID-19 unit at the United Memorial Medical Center and joins us now to talk about this. So I'm shocked, doctor, to see that gambling has been going on in this establishment. The collusion between the FDA and Merck to hide these DNA particles inside of this vaccine. Were you stunned to learn this?
Well, I mean, I wasn't, because as you know, we have gone through hell over the last 4 years. Some of us who initially believed that vaccines were safe and effective, now we have come and realized that nope, they are not safe, and definitely some of them are not effective. So when I learned about this, particularly about this lawsuit, and I started to learn that there was contamination of these vaccines with the DNA of the actual virus that causes cervical cancer, I said, what the hell is going on? So I wasn't impressed anymore, because we have gone through all of this for so many years. Now, I'm glad that this is at least being brought to the attention of people that are firm believers of whatever is displayed in an advertisement on TV every night.
Right.
So the HPV vaccine, interestingly enough, was recently changed its recommendation from 2 to 1. Now, we know that there's very little science to have ever recommended 2 or 1, much like the COVID vaccine. So do you think this is related? And do you think that maybe we will eventually get some kind of clinical trials to behind our recommended vaccine dosages?
Well, you know, if we can get a little transparency from these companies, I think we're going to be okay. I am not at the moment where I can tell you use or not use these particular vaccines. I will tell you, for example, for COVID, I will tell you, do not use them no matter what. I mean, that's simple. But for things like HPV, I want to see more data. And
yeah, me too.
Now that you're hearing that, you know, this particular HPV vaccine has been infected, or let's call it, has impurities, including DNA from the HPV virus itself, sitting on them. And this has been going on for almost a decade. I mean, that is scary. I would not want to give that to my kids. So, you know, I did give this vaccine to my kids years ago when we were told that these were, quote, safe and effective.
So I guess for our audience or myself who's unclear what it means to be infected with DNA, and they covered this up and hid this from us. What exactly does that mean, infected with DNA?
Well, it depends on the DNA that you're getting. So there are two things on this one. First of all, this DNA gets bound to the aluminum that is given in the vaccines. And that makes this DNA resistant to your own system of cleaving or getting rid of particles that shouldn't be in your body. So what it does, it keeps it in your system, and it gives you a series of inflammatory reactions. And people have this inflammation everywhere, and they can have something that's called POTS, postural orthostatic tachycardia syndrome. And in some cases, there have been even cases of sudden death. So you don't want something that will be giving you an inflammatory process in your system, because you are going to get in trouble if that happens.
Now, people have been saying for a long time that their, especially teenage daughters, have had symptoms that even looked a little bit like, I have a friend who wrote in her book that it felt like her daughter had some sort of Lyme disease even, and behavioral products. And she couldn't get answers. And so there's nobody, unfortunately right now, we have very little answers for what happens. So what is the recourse for people who have had adverse events from something like this now that we have this revelation?
And the problem is that there is no recourse that you currently have. First, you have to have a healthcare professional that thinks about it, because not all of them are going to think, oh, this is probably a reaction to this vaccine. Second, how are you going to prove it? That gets to be extremely difficult. Third, you need to look at what can I do from a legal standpoint, because, again, all of these vaccines are protected, quote unquote, but they don't deserve to be protected, especially if they were concealing information from us. If indeed Merck and the FDA were aware of these significant side effects that individuals can have, then that is malice. That is gross negligence, and that needs to be punishable.
It's deeply disturbing. Are you hopeful that we'll have under RFK Jr. more transparency? I mean, he was grilled by Congress. Basically, they, of course, trying to protect the biopharmaceutical complex. Many of them, Elizabeth Warren and others, Bernie Sanders, they'd received a lot of money from Big Pharma. He kind of walked a delicate fence line there during his confirmation hearings. But are you hopeful that we'll start to get some more transparency here about the testing and trials and what's actually going into these vaccines?
I think that if RFK fully gets the confirmation and people truly look at where we are and where can we be, I think that we will at least be able to know what's going on. And like I said earlier, I want data. I'm not an anti-vaxxer. I'm not telling people don't get vaccinated except for COVID vaccines. But for the other vaccines, I want to see the data. I want to know why, for example, the Amish population that doesn't get vaccinated, they don't get autism, for example. I want to know. I want to know what is going on there. Are we missing something? And then once I have that data, then I will explain that to my patients, and I'll tell them the good, the bad, and the ugly, and empower them to make whatever decision they want to make. So that's the most important thing. I think that with RFK, we are going to be able to get to that point if he doesn't have a resistance, or if somebody doesn't try to kill him for all of this.
Right.
Oh.
Well,
I mean, I'm serious.
It's literally the plot of The Fugitive.
Yeah.
I mean, I'm very serious.
Yeah.
I mean, I get very concerned because this man is bringing up information that is very scary for some companies. And if he truly finds out that this has been going on and it's not just a mistake that, oops, we screwed up, but it's something that was done and these people consciously disregarded the well-being of people, I mean, trust me, he probably has a couple of snipers on his head at this point.
Right.
Yeah, I mean, and his family has a history of that, so this is not out of the blue.
Yeah.
And we know from whistleblowers who've come forward in other related areas have wound up dead in their car and just as they're about to testify. So, he's up against a behemoth, a massive. It's probably larger, in fact, than the military-industrial complex in the United States, the biopharmaceutical complex in the United States, and they definitely do not like him very much. Dr. Joseph Varone is the former chief of critical care and COVID-19 unit at United Memorial Medical Center, and he's been outspoken about the COVID-19 vaccine, and a lot of states now moving towards maybe banning this altogether. So, Dr. Varone, thanks for fighting the good fight and keeping them honest. We appreciate you joining us today.
Thank you so much.